nurses, Karen Jenkins from the high school, Jill Young from the middle school, and um, Erin Taylor from Pond Cove. Welcome. Thank you for being here this evening. Karen, are you the spokesperson?
Hi, yes, I am the spokesperson. I'm going
Thank you.
to go ahead and share my screen here. I put together some slides really just to help keep myself organized, but I'm happy to, oops, didn't mean to do that. This is what I meant. Happy to share these slides as needed. Again, I'm Karen Jenkins, a school nurse at the high school. I'm joined by my school nurse colleagues, Erin Taylor from Pond Cove and Jill Young from the middle school. And we only have about 10 minutes, but gonna go talk about some highlights in terms of where we are in the district in terms of COVID-19, school safety, a little bit about how contact tracing works, and sort of touch upon some of the health and safety measures in our schools that have really contributed in keeping schools as safe as they have been. So in a nutshell, the schools are doing pretty well. And I would say compared to what we were all expecting when we were doing all the planning back last summer, way better than expected. And statewide, the studies would show that schools transmission is really quite low, and it's especially low compared to community transmission. In fact, it's about a third of the rate of community transmission. And most of the cases that we are seeing that have been associated with a school are really the result of community transmission. So what that means is, what we're not seeing is people that are actually contracting COVID-19 through their school contacts. In other words, students and staff members aren't catching COVID from each other during the school day in the school setting. It's mostly a community acquired case that then has ramifications in the school setting. So let's say a parent, a family member gets COVID, a student then contracts COVID, comes to school before they know that they're sick. We have close contacts related to that, and that's sort of mostly what we're seeing, as opposed to direct transmission from one person to another within the school setting. And the public health experts are saying that those low transmission rates are because of all the school health and safety measures that we have in place. So there's kind of a tendency to want to then withdraw some of those measures, but there's a public health saying that says when public health's working, nothing happens, and that's partly what some people feel that we're seeing in the school is our transmission rates are low, but that doesn't necessarily mean we let down our guard here. So last Friday, Governor Mills and Dr. Shaw did a little video shout out, really thanking not just Maine teachers, but all school staff in terms of acknowledging how low our school transmission rates are, and also recognizing the many efforts that people throughout the schools, and also the families and the students themselves, all the things that they're doing to keep our rates so low, all the health and safety measures that they've been working so hard to be compliant about, and also guidance to really not let down not let down our guard, that we are still in the middle of this pandemic, and it's too early to disregard our measures at this point. We need to stay the course. So if you haven't seen that video, I recommend you take a quick peek at it. I'm not going to take the time to show it now, but there's a link that is worth looking at. So the safety measures that we're talking about are the things we've been talking about for months. Certainly face coverings, physical distancing, and along with the distancing then becomes reduced class sizes, mostly in terms of the physical limitations of buildings and school classrooms. Hand washing. The pre-screening tool has been incredibly helpful in terms of reducing people with travel restrictions or early symptoms. It's keeping them out of our buildings while they're seeking medical care and awaiting testing. That's really helped reduce our exposures. All the cleaning, sanitizing measures, and certainly the new ventilation projects that we're starting, all those will also help with our school safety issues. So just to talk a little bit about what we do if we do have someone associated with a district who tests positive for COVID-19. There's really a team approach in terms of figuring out the best plan for this. And all of the decisions made are guided by the current guidance from the Maine CDC and the Department of Education. And keep in mind, we have to follow the Maine CDC, which is not always exactly the same as the US CDC. But both the Maine CDC, the DOE have worked together to create something called the SOP, a few little alphabet soup there, but which is the standard operating procedure. And we follow that to determine really what our best next steps are. So we interview the person that's tested positive or the family members. And our initial goal is really just to support these people, to provide guidance, to share resources with them. And then we also talk with them in terms of identifying what implications this case may have on the school setting as a whole. So we look at when their symptoms developed or their test was done, when they were last in school, get a little sense of who close contacts might be, and then work as a team with administrators, the nurses. We may need to pull in facilities or transportation or special services, just sort of say, okay, this is the situation we're dealing with. What are the implications? What do we need to do from here? What do the guidelines say? How can we kind of think outside the box in terms of doing all we can, to minimize the impact on others? And our goal is certainly to keep schools open as much as possible for in-person learning. Staffing issues sometimes get in the way of that goal and may cause us to transition to a full remote option, which is what many of you are dealing with this week. But by far, safety for everybody is our highest priority. So why do we do contact tracing? And this is really to identify people who have been in contact with the individual who test positive. And this is intended to reduce further risks of exposures. So we know these contacts are higher risk of developing COVID-19. And so we want to limit their exposures. They're in quarantine such that if they do develop symptoms or test positive, we've sort of broken that chain of transmission and protected others, especially others in the school. The period of time that we're most concerned about is the 2 days before and up to 10 days after this individual's symptoms started, or if they don't have symptoms whenever their test was collected. So that's that window of time we're looking at. And sometimes there's a little bit of delay of when the test results come back and when they were last at school. So the quarantine period, the details can really vary from situation to situation. So again, we follow the CDC, the DOE contact tracing guidelines. And the typical definition is anyone that's been within 6 feet for 15 minutes or more. And that's cumulative. It could be like 3 5-minute periods of time, for instance. But it's important to recognize that the DOE actually casts a much broader net in terms of contact tracing. It's a more cautious approach than the typical CDC definition. So they would identify an entire classroom as close contacts. There's also some situations that are evaluated on an individual basis, primarily cafeteria settings, school buses, some of the athletic events, some of those areas that occur in a large physical space. So there are individually determined situations, but for the most part, an entire classroom would be placed in quarantine. Household members are pretty much automatically considered a close contact. And we see that often in school. There's a family member that tests positive, and then any students in that household will be in quarantine typically for 10 days. And again, the situation can vary significantly from one situation to the next. The number of close contacts can vary. And the number of contacts identified doesn't necessarily indicate the level of risk to other people in the school. It may just be a reflection of whatever that individual schedule was, or if there were other support people involved, or if there was athletics involved. So it may be more people identified as close contacts, but it doesn't necessarily mean the school as a whole is at any a higher danger than they had been. Um, Contact tracing is a challenging process. We try to find that balance between being cautious but not overly cautious, and we do all that under the guidance of the CDC and DOE. So once we've created this list of contacts, and again, this is kind of challenging, we have to do sort of a backwards approach, mostly because of all the privacy and confidentiality issues. We can't just, put out an all call to say, hey, Johnny Doe has COVID, who's been in touch with them. We have to sort of look at attendance records, Power School reports, talk with special services. The high school has kind of a neat little QR code system. So we have some spaces that are sort of variable in terms of attendance, and students can go in, scan the QR code with their phone, do a quick little form, and then if we ever need to go back and say, okay, who else was in that room, where were they sitting, we have a means to track that. Once we develop this list, the nurses make calls to all the families or the staff members. We feel that's important in terms of being able to answer their questions, address their concerns. And we send a follow-up email with resources, sort of reiterating when they can come back to school, some links in terms of testing information, when they should get tested, and that sort of thing. And it's just important to note, to recognize that this is a really stressful time. We recognize it's disruptive, it's stressful. Contact tracing is not easy. It's quarantine is not easy. And we realize that this is a big ask of families. And I'm forever impressed by how gracious and patient families have been through this process. So just to sort of summarize the systems that we have in place that have been helpful in reducing the number of close contacts we have, and especially in reducing our disease transmission. So our small class sizes kind of by default reduce our contacts, and also the additional space, physical space between people helps reduce our transmission risks. The cohort system, because people are in those small groups that are with the same people consistently, reduce our contacts. And by being in school fewer days, it does reduce the number of days that we need to contact trace, when we're looking back at that, time of exposure. The remote learning options that we have available really do support the process. So if we are asking students or staff members to be in quarantine, the remote learning options help them keep engaged as much as possible, and it helps reduce that lost learning time as much as possible. Let's think of the options at the high school have been especially helpful in terms of also the teachers not having to spend as much time trying to catch them up if they've missed time, catch the students up. And the remote options have also supported people who have had to miss school either due to mild symptoms, or they're waiting on a COVID test, or they've had travel issues. And even if they don't test positive, they're not officially in quarantine. They've been able to promote school safety by utilizing remote learning opportunities. And the high school's mini terms have also reduced our contact tracing, our exposures, because we're really looking at just 4 classes a day instead of up to 7, or not even a day, even over the course of a week. So that's really been helpful in terms of our needing to put as many teachers or students in quarantine. So all these things that we're doing are contributing not only to our school safety, but also reducing our close contact identification and quarantine situations. So the guidance that we've been hearing from the Maine CDC is to just stay patient. We know this is a tough time. People are tired of it. We get it. This has not been easy. And they're stressing that school transmission is low, but it's been low because of all our current measures. we're all hopeful about vaccine that will certainly reduce the staff members' need for quarantine, which is going to be helpful. But unfortunately, that rollout's been slower than we'd all like. There is concern about these new strains of COVID-19. The school nurses, we're in close contact with other school nurses. We attend weekly meetings with school nurses throughout the state and the CDC school nurse liaison, and also keep abreast of the latest CDC updates through their meetings and weekly updates. So, you know, from the comments earlier, I realize that many people are anxious for our protocols to ease up, for creative thinking. I'm all on board with that as well. But there's also others that want our guidance to be even stricter, and we need to consider those cases. So I feel like we need to be very strict with our guidelines. We do need creative approaches, but we need to err on the side of caution. And we need to make decisions that are made for the well-being of our entire community. Recognize that we're all tired, but at this point we've come too far to ease up too much or too soon. So that was a lot. I'm going to stop sharing, but certainly happy to answer any questions, either Erin or Jill or I, and always welcome to answer any questions if anyone wants to reach out to any of us later.
Yeah, so Karen, I'd like to first of all say thank you. And thank you to the 3 nurses for all you have done. And just to clarify, the way the structure of our board meetings is that these questions currently right now are for board members. Karen did share emails up there and phone numbers. So if you are in the public and you have some questions, I'm sure that the nurses would be happy to respond as best they can. So that would be the avenue to reach out. Are there any board members that have a question or comment for Karen or Jill or Erin? Go ahead, Phil.
A quick question. Yeah. First of all,
Phil?
as Heather said, I wanted to thank,
Yeah.
Can you hear me? Yeah. First of all, I just want to thank you, all 3 of you, so much for all the work you guys have done and kept our kids and staff safe. Just a quick question on the spread issue. It sounds like, as you were saying, that you've had mostly community spread and not school spread. Have we had any cases where we've had positive cases that have spread within the school from someone who tested positive? Or have you been able to contact trace and quarantine before that happened?
It's always a little bit, thank you for that question. So it's always a little bit too difficult to fully know how the whole thing plays out, because we also have asymptomatic transmission. We have had 3 cases, I'm thinking, that I know of throughout our schools where we've had someone in quarantine that subsequently tested positive. None of which who developed serious illness or even symptoms, I think, at that matter. They just had a follow-up test that was positive. We have had many other people in quarantine that either from community transmission, community situations, but I'm counting 3 in my head. Again, we don't know 100% that that's how it all transpired, but they were in quarantine and did end up being positive.
Thank you. Thank you very much.
Jen, go ahead. You can unmute yourself.
Thank you. I did. I just have a question. I know that there's been a lot of talk about the 6 feet versus the 3 feet, and I know different kids have different lunch situations. So within the classrooms, I understand we're at 6, and how many of our students are actually eating in their classrooms versus eating in the cafeterias, and how much does that play a role on the number of students that we can have in a classroom?
Jen, I can speak mostly to that because it's mostly at Pond Cove where the students are eating in the classrooms. We have our kindergarten students and our second graders who eat in the classrooms, and that's mainly a result of the fact that we have a shared space with the middle school. And so we have to try to accommodate multiple lunches with the spacing that the CDC guidelines tell us to have in the cafeteria. So that really limits the amount of time in a school day that we can get grades K through 8 through the cafeteria. And so that's why we have the 6 foot distancing at Pond Cove. Also because the students K through 4 have snack time during the day, and the guidelines state that kids have to be at least 6 feet apart when they take their masks off to eat.
Thank you, Erin. And is that the same like with water breaks and things like that for the 3 to 6 feet?
Correct. Yep.
Just to clarify on eating breaks, eating and drinking is at least 6 feet. And the Maine DOE has specific guidelines to those mask breaks. In addition to designated eating times, which would be breakfast and lunch, the DOE has specific guidelines. They can have up to 3 mask breaks, all of which need to be outside, stationary, facing the same direction. That is and no more than 5 minutes each. So that's up to 15 minutes for those 3. And that's per the Maine DOE guidelines.
Thank you, ladies.
And
thank you for all you
6
do.
feet apart, sorry, and 6 feet apart.
Thank you. And thank you for all you do.
I saw Kimberly and then Cynthia. So go ahead, Kimberly. Kimberly, are you? I'm freezing in and out.
Yeah, sorry, I was muted. Yeah, I just want to really just thank the 3 of you for all the work that you have put in. I know this summer was long, a lot of hours, and the school year hasn't changed that very much. So I appreciate that. I appreciate the care with which you consider the needs of all the community members. And I have kids in all 3 schools. Yeah, I guess I appreciate, it's unfortunate that we're closed this week for sure, but I appreciate so much the amount of in-person schooling that we've been able to offer consistently to our students and our families this year. So I attribute a lot of our success to all that you guys have done and all the planning that went into this. So thank you.
Thank you.
Cindy, go ahead.
Hi, thank you all. I'm echoing everyone else's comments on the wonderful job you've done to keep everyone safe. And I really appreciate this presentation. I think this information is really critical to share, not just with the board, but with the community. And I appreciate having that extra level of understanding for that. I do have a question. I actually went and read the SOP that you referred to, and I know we've had some questions around it as well. There is a statement, I think in a more recent update of that SOP that's talking about, it has to do with staff quarantine measures and staff that are essential workers. And I'm not sure if you're familiar with the section. I actually pulled it up because I want to, I guess, understand how we are interpreting that within our quarantining. And I think this did come up by some community members once in response to the closure that we had. And it did talk about school staff that are considered essential workers who are close contacts. And it has some stipulations about if they could return to work while in quarantine. And says if there are no substitute members available, they take appropriate infection control, including PPE, and the staff remains in quarantine outside of work. And of course, it says under no circumstances a positive COVID-19 case should be in the school setting at all. But I just wondered if you have, I guess, how would that apply or not apply in our school situation? And do we have a direction that we follow on that piece of it?
Yeah, good question. First of all, thank you. We are very familiar with that document. I think we practically know that one by heart. That's how we operate. So These decisions are not made lightly. I have kids in the school system. That's my job, is to care for the kids there, their well-being, our staff's well-being, our community's well-being. So we don't make these decisions lightly. We as nurses attend these meetings with administration as the decisions are being made to provide the guidance as a nurse, and then the decision is made ultimately by administration. But we do refer to the SOP in our guidance to administration. As Karen mentioned, we also err on the side of caution, as we do have a large community to protect. I just want to speak a little bit too to this. We'll get back to the question, but transparency. There's been a lot of questions about transparency. We do have confidentiality obligations, professional obligations to protect confidentiality. Sometimes when we're dealing with groups of people, that would be identifying and not protecting their confidentiality. But what I can tell you is that we've worked really hard to be transparent as far as numbers go. And you may say, well, we've never seen numbers, but every time we've had a positive case that has directly impacted our schools, meaning the individual that tested positive was in our school or on a sports team or on our buses, within our schools during their infectious period. So infectious period is you backtrack 48 hours prior to the swab date if asymptomatic, or 48 hours prior from symptom onset. So every single time we've had a positive case that has directly impacted our school, meaning that that individual is infectious in our schools, we've sent out a letter. So you can go back and count that way. But we don't share close contacts. I don't think that that's relevant in making a decision. You could have a lot of close contacts or very few close contacts, and the measures would be the same. What that does tell us, though, is that things are working. I said I have kids in the school, and I have a husband that's an educator at the high school. We were not fans of the mini term, let me tell you that, as an educator or as parents. But the first time that we contact traced in the high school was eye-opening. The mini term works. We quarantined very few. I think I could count on both hands how many were in quarantine from that case, which is remarkable. Normally there's several students interacting, they're transitioning class periods 7 to 8, I think, a day. So that mini term was beneficial for that reason. We've also seen the benefit of quarantine. So as Karen mentioned, we quarantine those individuals that are identified as close contacts based on the CDC guidelines that we follow for that. And we have had individuals test positive that were in quarantine. And we've had them test positive sometimes after they've been out and their infectious period did not have an impact on our schools. We also have parents that have tested positive, family members that have tested positive, students that are out in quarantine because their family members have tested positive who have later tested positive. So these measures work. So to get back to the SOP, when we're making a decision for staff, yes, staff are considered essential workers, teachers, bus drivers, cafeteria workers, custodians, they are considered essential, nurses considered essential workers, but it is an option. And when making that decision, knowing that we've had people in quarantine who have later tested positive and that these measures work and they're in place for a reason, and we've seen the benefits of that, to then bring these folks in and potentially cause more harm than good and potentially spread the virus. That's a hard one to swallow as administrators and nurses, to know that we are potentially exposing more. And while kids may not, you know, the research is out there that shows kids may not be as susceptible and they may not transmit, we still have adults in our building and they go home to others, and we just want to make sure we're making the best decision for our entire community. We do weigh that option. We are aware of that option, but it is an option when there are no others. And we felt that ultimately is an administrator option or decision, but we felt that with remote learning, I believe that that shows it's not ideal. Again, I have kids, I have an educator as a husband. It is far from ideal, but it's another option. It's not a snow day or a power outage where we're out for the full week. We do have other educational opportunities available.
Thank you. I appreciate the explanation.
I have one question, and maybe you can speak to, there are times when we've missed in one of the schools a day. And currently we're in a situation where 2 of our schools are closed for a whole week. And I recognize that there's a confidentiality issue happening, but I'm wondering if you can just speak to the difference of when it happens for a day and why this situation is so much more extensive and so much longer.
You want me to take that one? So administration could speak to this as well, but the decision is ultimately, and I think Donna's second email addressed that, but it's related to staffing concerns and the inability to keep our buildings safe due to those staffing concerns for various reasons. So, and I think we'll be a little clearer in that in our first message that goes out to the community. I know a lot of people were concerned and upset, but do know that we are being as transparent as possible while protecting the confidentiality. And the first letter, individual, so that's one, had tested positive. But the reason for closure typically is related to staffing concerns. And I know we talked a lot about that in the summer, that we had anticipated, wow, if we get a lot of cases, it's going to be the staff that make it really hard to stay in person. I do feel from our neighboring schools that I think we're very fortunate that this, luckily, I know it's extremely unfortunate this week missed, or remote, I should say, but I do feel very fortunate that we've made it this far. It's surprising. And I think Donna says that she's asked in her superintendent meetings, are you sure your nurses are telling you how many cases you have? Because we have 15 this week and you've had none since the beginning of January. So I do feel fortunate, and I think that's also evident our measures are working.
I just want to
piggyback just a smidgen onto that too. I'm sorry, but sometimes it's also the length of time is dependent on sort of the timing of everything. You know, if we look at sort of that 2 days before, 10 days after window, and sometimes by the time we, you know, someone's had their positive test result report back, they're already several days into that, or we might have had a weekend, or maybe with a hybrid model, you know, people were already out of school for a couple of days. So sometimes just by nature of the timing, we've been able to reduce the number of closures. We've also been fortunate, like sometimes, you know, I remember with the summer planning, we were anticipating having to transition to remote just to support the contact tracing process. Like that was in our initial letter. We're going to close for the day so we can do contact tracing. Like that was our expectation. And we've actually been able to, I think we did that once or twice, but been able to keep schools open either because we were able to manage things over the weekend and we're ready to go, or on the evening, or have systems to sort of help facilitate the contact tracing process. So we have been able to minimize some of those closures, identify contacts. And for most people, for the people in quarantine, yeah, it's a total drag. For most people, we have been able to stay open and really minimize those fully remote days. So.
For each situation, we meet those people that are involved, those people that it would impact as far as administrators. The 3 nurses always meet with us. Sometimes it's Perry because it's a facilities or transportation issue. We meet, we discuss options. We're always, our focus is first on safety and then on trying to keep our schools open. And often we can be creative and think outside the box and come up with solutions. I want to remind everybody back, if you think back to the busing issue where we came up with very quickly a totally different busing schedule, a 2-way schedule, so that we could use some substitutes and get our students to school. Every situation we study and discuss options. This Saturday, we got notice of a positive test and we got together Saturday afternoon and discussed options. And sometimes there are no other options when you err on the side of safety other than to close the buildings. And unfortunately, that's what had to happen this time. We did look at, believe me, all the options. We discussed lots of different ways we could address this, and this was the safest one that we could do with the limited staffing that we had due to the situation. So,
Heather, I have a quick question. So I appreciate all your work and everything that you do, and all the presentations and the presentation that Karen did. That was great and well needed. And I like what you said, Donna, about how you did think. I mean, you think about creating creative solutions and outside the box constantly. But my question is, it's going to that, can we actually open? We had a lot of people speak about, why can't we think of creative solutions for 5 days a week or 4 days a week when we have other children in different states going to school Monday through Friday. So there was a lot of questions on that. But it seems to me that no matter how creative we can get, if we want to follow the main CDC and if we want to follow the main DOE that states 3 feet apart for students, 6 feet for adults, 6 feet for students while eating, we can't double our building size. We can't double and hire, twice as many teachers. Is there really any creative solutions there, or is it we just have to follow the guidelines? Can you speak to that, Donna?
Yeah, sure. We have limitations on space because of our buildings. Newer schools have larger classrooms and more open spaces, and they're able to have more students in their classes. Because our rooms are smaller and we have limited space, we would have to hire double the amount of teachers, as you said, Laura, and our budget just doesn't support that. You can imagine we spend 84% of our budget right now goes towards benefits and salaries. That would be a huge chunk for the community to come up with to hire double the amount of teachers if we even have the space to put those teachers. So it's really space, and staffing is a huge issue. And not only would you have to hire double the amount of teachers, but you think about custodial space, busing, because we're still under restrictions about busing and the spacing that needs to happen on the busing. We only have a certain amount of buses and bus drivers. Everybody's heard about the problem in Maine with limited bus drivers. So we have looked at this, and we do continue to look at this over and over again and talk about different options. And this is where we are right now. We do have to follow the Maine CDC guidelines. Private schools do not have to follow Maine DOE guidelines. They're not under those restrictions. And other states have different guidelines. Mm-hmm.
So it would be a lessening of the restrictions of the guidelines in order for us to think about opening the schools for more days.
We would need Maine DOE to change their guidelines for spacing, social distancing in our schools. Yep.
Thanks for that clarity. I think it's an important reminder to the community. Thanks.
Go ahead, Phil.
Thanks, Heather. Yeah, just very quickly, I just want to say this conversation is really helpful, and we haven't had it publicly for a while, and I'd love to see it to continue. I actually thought that was an excellent suggestion that some of the parents made, Dave Hughes and some others. Just this conversation itself, I think, is helpful, and we're hearing some great information from the nurses and some good questions from the board members and the public. So I would like to see this kind of update, and maybe we tackle different types of the issue and the problem each month, but to put this on again and to continue to hear about this. I think just more information is always going to be better.
Thank you for that, Phil. And I wasn't going to bring this up right now, but one of the things we're also trying to do in the spirit of improving communication is to perhaps create some documents that can be referred to on the website, like frequently FAQs or bullet points. So people are sending in questions, they're asking questions, they're good questions, we appreciate them. It's all confusing, it's all frustrating. And so just to know that that is something that's happening in the background, though you're not seeing it right now, it is happening in the background. I also see that there are some people writing questions in the Q&A and hands raised, and our policy right now, I know it might be frustrating, is that this is time for the board because we do have a full agenda ahead of us. But the nurses have said they're happy to answer questions. So if you do have a question, send it to the nurses, send it to the board. We'll do our best to get your answers. But we are going to